So Renee, when you called in the other day, the girls said that, or they told me, they relayed to me that you were interested in this procedure where you have your teeth done all in one day because of an accident that you had, and we deal with that kind of thing as well. I mean, all kinds of reasons why people have to have teeth replaced. This has become one of the most rapid growing answers because it addresses a lot of things. For instance, for people who haven't had teeth, their own teeth, for many, many years, oftentimes a lot of the bone has gone, it's missing. And so it used to be that you would have to graft bone before you could do anything. But now this procedure allows us to do it in about 90% of the cases without having to graft bone. So there's not surgery after surgery after surgery. It's simplified things, and it's made things happen much more quickly, much more efficiently, and without the need for long periods of habituation. I mean, getting used to the new stuff that's in your mouth. Because dentures take up a big part, and you've already fought with those, and that's why you're here, okay? It is a surgical procedure, okay? It's a procedure where we have to place implants, dental implants, which are very, very successful. It's done over a period of about 4 to 5 hours, depending on the particular needs of your body. For instance, if you had a lot of teeth left and they were badly decayed, and so it would take some time for us to remove these teeth and to shape the ridge that the implants are going to fit, the ridge of bone that the implants are going to fit in. And that would take a longer period of time than someone like yourself, where this happened a period of time and now you've been wearing the denture. It's just very uncomfortable for you. It doesn't give you the freedom that you would like, and you just feel like that ever since you had that accident, you're just not yourself. So it restores people's ability to not think about themselves as much. They can really have the freedom. They can go eat with their friends, they can smile, they can interact. There's no concern about what are their teeth going to do if they're not careful about keeping them in place with their tongue or their cheeks, which is often the case with a lower denture especially. The way that we do this, as I said, we place implants into the bone. All dental implants are surgical. So no one, whether we're taking a tooth out and putting an implant in that very day, or whether they've had a tooth missing for a long time and we're placing, it's all a surgical process. This is basically what you'll look like when you're finished. I mean, you'll have these beautiful teeth, and they will be anchored. See those implants there on the side? You can see right through this model. And when you're finished, you're secure. You can pull a Volvo out of a ditch with this. Well, not quite, I'm kidding, of course. But it's secure. It's not something that you're going to have to be concerned about. Will you have to learn how to speak again a little bit? Yeah, probably. There'll be some kind of rehabilitation, but you know, we have situations where we see people, we do this, and before they leave that day, they are out of the sedation that we've used to help them go through this procedure very comfortably, and they're speaking to us, and they're speaking to us as normally as I'm speaking to you. So it's very, very rare that we have people that are handicapped at all by the placement of something like that. They get it. I mean, it works for them. I had a woman in yesterday, as a matter of fact, and she was speaking to me even while she was numb, and with her new teeth, we did this procedure for her, and she was speaking to me just like this. And of course, before we let people go after they've had the procedure, they have to be able to have a conversation with us. They have to be able to be ambulatory. If they had to make a trip to the washroom, they could do that on their own, that kind of thing. They have to be recovered to that point. Okay? So it was very interesting to see that she was speaking quite naturally already. Did you have any burning questions about this whole procedure? Nothing? Does this answer some of those concerns that you might have had? Like, you're going to have a sedation, that's what's going to happen. You won't have any memory of having the procedure done. I noticed there's 2 or 3 teeth that on the top that you still have, and there's a sort of a partial denture. But we're just talking about the bottom teeth, right? Just the bottom teeth. Okay, well that'll work, that'll be just fine. Now, when you decide to do this, we'll bring you in and we'll take molds of your teeth. We'll have the teeth made up in advance so that when you come in, we're all ready to make that bridge for you. So there's a couple aspects to this. The 4 or 5 hours is something where, first of all, you're sedated. Then we do put numbing in your mouth so that all sensation is removed, other than noise and vibration and stuff. But you won't care about that anyway because you'll be in a twilight sleep, okay? And then we do the surgical part of the procedure, and we place the implants in. And then we actually go through a prosthetic part, or the construction of the bridge work. And we take measurements of exactly where the implants are in your mouth now, and we transfer that to a laboratory model. And from that laboratory model, we build the bridge, okay? And then we insert the bridge, and it's actually, as I showed you here, can you see where we've actually, those holes right there? We've actually screwed that bridge right into place so it can't move, all right? And at that point in time, you leave, you'll have some stitches underneath the teeth, and in about 7 to 10 days, we'll bring you back. Quite a significant amount of healing will have taken care. Most of the areas, the way that we've gone into the gum line and into the bony ridge, that'll be pretty well knit up again. It'll be closed up. So we actually unscrew the teeth, and we then take out the stitches, make sure everything is comfortable, help you learn how to clean underneath, and then we just monitor you over a period of about 3 months. During that time, the bone is integrating into the actual implants. When we put the implants in, they have to go in kind of firmly. Okay? They have to go in, I don't know that you do anything with woodwork or anything, but if you were to take a screwdriver and drill a hole into a piece of fur, and then you were to screw in a wood screw, it has to be about that firm. So it's actually pretty firm in there. And there's at least 4 of them. And then the healing will take place by the bone and the gum growing in and around the implant over a 3-month period. After the 3 months, we bring you back and we take new measurements. And we take new measurements because we're going to build you a permanent bridge that will look very much like what you had in the temporary bridge, and we're going to place a titanium bar in the matrix of these teeth and gums that make up your bridge. And that will keep this very, very strong for a very long period of time. Now, one thing that we're finding out about these implants and about this technique is that they work wonderfully well. The bone is retained well in implants. Back in 1986, when I was first getting involved in implants, they said to us that we would lose about 1/10 of a millimeter of bone every year. And I thought, well, that's great. If you're 70 and you die at 90, there's only 2 millimeters lost, right? But if you're 25, if you're a young person, there you've got these big stilts, gray stilts sticking out of your gums. Not so. The implants are staying, and we are not losing the bone around them. They are doing a wonderful, wonderful job. So this is something that's going to be quite permanent. You as a young person are going to be rehabilitated. You're going to be reconstructed. Your teeth will be reconstructed. You'll have speech. You'll have everything that we've talked about in a very nice way. So then about 6 months from today, you'll have a permanent, beautiful set of teeth that are strong as ever can be. Now, one last thing. Once you have something like this, you have to keep them clean, and you will have to see the hygienist a couple times a year. And if we find that you're doing a great job, then we use our tricks of the trade to clean and make sure that this is in good shape. If you're a person that doesn't clean very well naturally, and some people are good at it and some people aren't, well, we'll actually unscrew it, clean it, polish it, make sure that it's completely in pristine shape from all. We'll inspect it, we'll see how hard a bite. Some people have tremendously hard bites, and so that can affect the way the teeth wear and the plastic and everything else of the teeth. So we'll look at that, and then we'll help you and coach you a little bit more on how to clean. All right?